Hey guys, welcome back. And today we are going to see the nursing care plan and nursing diagnosis for myocardial infarction. So, from this image, hope you can understand what is heart attack or myocardial infarction. So, let's see what is heart attack or myocardial infarction. We'll see the definition and overview first before going to nursing diagnosis and care plan. A heart attack or myocardial infarction, okay, is an extremely dangerous condition that happens because you don't have enough blood flow to some of your heart muscle. From this image, you can easily understand how the blood clot will occur in the blood vessels. Blood has to pass smoothly through your blood vessels. Then only the functioning will take place in the proper way, or the process or the heart functioning and the overall functioning will take place in the proper way. If there any block or any clot like traffic, heavy traffic or traffic jam in the road, means how the your vehicle will go, you can imagine. So the same thing, okay, if any traffic jam or any clot or any plaques, okay, in the blood flow, definitely that can affect the proper passage of blood to the heart, and that can lead to heart attack or myocardial infarction. The spelling is bit different. Infarction, okay, INFARCTION. Okay, this lack of blood flow can occur because of different factors, but it's usually related to a blockage in one or more your heart arteries. So we have arteries, okay, arteries, what arteries is doing, what veins are doing, we are studying in the anatomy of heart. Okay, vein is carrying the oxygenated blood to your heart, and artery is carrying all oxygenated blood from heart to all part of our body. All right, so there is, if there is lack of blood flow, means definitely heart attack will occur. So the simple definition is myocardial infarction is the irreversible death of heart muscle due to prolonged ischemia. Ischemia means what? A lack of blood supply to the proper area, and that can lead to ischemia. Okay. Then what is the cause, or what are all the causes? Means atherosclerosis or any blood clot or blood flow blockage, okay, or artery spasm, okay, all it can occur due to any block or plaque formation in the blood vessels. Symptoms, definitely chest pain, and there will be a radiating chest pain. Okay, it will not be like a normal chest pain. Radiating chest pain, like stabbing chest pain, shortness of breath, nausea, sweating, and fatigue. And you know the importance of nursing care. That's what we are creating this nursing diagnosis and care plans, and it's critical for minimizing damage and promoting recovery. Okay, so heart attack, myocardial infarctions, and all long-term conditions. So once it occur, it's occurred, and we have to take proper measurements to manage the condition. Complete cure is not possible, but we can manage the condition by giving proper surgeries, proper medication, proper nursing management. So let's see the nursing management. So what are all the goals of this nursing care plan for myocardial infarction or heart attack? Are relieves pain. That's the main thing, right? For example, immediate goal means you have to, or we have to reduce the chest pain, or we have to give a relief from pain. Okay, then restore the blood flow and prevent the complications, because if there is no blood flow to heart, means, or it's persisting for a long time, means definitely death can occur, or sometimes paralysis. Okay, okay, coma kind of situations can occur. So the immediate goals are relieve pain, restore blood flow, and prevent complications. The long-term goals include improve cardiac function, promote lifestyle changes, and support emotional well-being. That's what I told you. These are all, this heart attack, myocardial infarctions, and heart diseases, okay, diabetes, hypertension. All these diseases are long-term conditions. So, some long-term goals we have to develop to improve the overall well-being of the person. In this case, the long-term goals are improve cardiac function, promote lifestyle changes, and support emotional well-being. And and our normal, regular, immediate goals are relieve pain, restore blood flow, and prevent complications. So here again, I am showing you the images. So just look into this image and just give a close look to this image. So if you give a close look, you can write the definition of myocardial infarction or heart attack. So there is a block in the blood flow, okay, blood flow in and the flow towards what heart muscles, heart or heart blood muscles, okay, and the vessels. So this blood flow damage or blood flow block, okay, due to any plaques or clot or anything, can leads to a heart attack or what myocardial infarction. So while coming to the nursing diagnosis, the first nursing diagnosis is decreased cardiac output. Already I have discussed about decreased cardiac output, and detailed nursing guideline is there in our channel. Okay, you can go to that video and you can check the detailed nursing diagnosis and care plan. Again, I'm adding the nursing diagnosis for decreased cardiac outputs. Okay, so decreased cardiac output related to impaired heart contractility secondary to myocardial damage, as evidenced by hypotension, chest pain, ECG changes, and reduced peripheral confusion. So while writing the nursing diagnosis in Nanda nursing diagnosis format, you have to write an etiology, okay, the condition, then related to, okay, etiology and evidenced by symptoms. So related to, evidenced by, these two things are very, very important. So you can write decreased cardiac output related to impaired heart contractility secondary to myocardial damage, as evidenced by hypertension, chest pain, ECG changes, reduced peripheral perfusion. So what is decreased cardiac output? Means insufficient blood pumped by the heart to meet the body's needs. That is the definition of decreased cardiac output. Insufficient blood pumped by heart to meet the body's needs. So that is the first nursing diagnosis. Second nursing diagnosis is acute pain. Okay, acute pain related to ischemic injury of myocardial tissue. Okay, myocardium is a layer, guys. Okay, there are three layers for heart: pericardium, endocardium, myocardium. Pericardium is the outer layer, myocardium is the middle layer, endocardium is the inner layer. So acute pain related to ischemic injury, that means lack of blood flow leads to ischemia. Ischemic injury and lack of blood flow can lead to damage of the blood vessel, blood cells. So ischemic injury of myocardial tissue, that's the muscle layer, okay, as evidenced by verbal report of chest pain, restlessness, and diaphoresis, like increased sweating. All right, so that is the second nursing diagnosis: acute pain related to ischemic injury of myocardial tissues, as evidenced by verbal report of chest pain, restlessness, and diaphoresis. Third nursing diagnosis: risk for ineffective tissue perfusion related to obstruction of coronary artery. Okay, risk for ineffective tissue perfusion related to obstruction of coronary artery, as evidenced by the same thing: verbal report of chest pain, restlessness, and diaphoresis. Again, what is ineffective tissue perfusion? Means vulnerability for decreased oxygenation of tissues. Okay, so it can lead to shortness of breath. Okay, it can lead to pain, it can lead to restlessness, it can lead to diaphoresis, and also it can lead to complete blackout. All right. Then next nursing diagnosis is anxiety. Anxiety related to fear of death or disability, as evidenced by verbalized concern, increased heart rate, and restlessness. Obviously, anxiety will arise if you have, or if we have heart attack or any chest pain or anything related to heart, and we know very well that if it that left untreated, that can lead to death, or sometimes more than that, more than death. What is that? Like uh, disabilities. Okay, disability can occur. That's more vulnerable and more complicated and more dangerous than death. So obviously anxiety will arise. So anxiety related to fear of death or disability, as evidenced by verbalized concern, increased heart rate, and restlessness. Another nursing diagnosis, risk for activity intolerance related to imbalance between oxygen supply and demand. So what is activity intolerance? Vulnerability to insufficient energy for daily activities. If you have heart attack or if you have chest pain or if you have anything related to heart, definitely you will feel tiredness and you cannot perform any activities with the regular energy which you have. Okay, so definitely you will feel vulnerability. So risk for activity intolerance related to imbalance between oxygen supply and, and demand, as evidenced by the same thing, verbalized concern, increased heart rate and restlessness. So these are all the major nursing diagnosis, guys. So again, I'm repeating. So first one, decreased cardiac output. That means insufficient blood pumped by the heart to meet the body's needs. It decreased cardiac output related to impaired heart contractility, as evidenced by hypertension, chest pain, ECG changes, reduced peripheral perfusion. Acute pain related to ischemic injury of myocardial tissue, as evidenced by verbal reports of chest pain, restlessness, and diaphoresis. Risk for ineffective tissue perfusion related to obstruction of coronary arteries, as evidenced by diaphoresis, restlessness, and chest pain. Anxiety related to fear of death or disability, as evidenced by verbalized concerns, increased heart rate, and restlessness. Risk for activity intolerance related to imbalance between oxygen supply and demand, as evidenced by increased heart rate, restlessness, and verbalized concerns. All right, so now we will see the nursing care plan for each nursing diagnosis. So I'm writing the planning and rationale here. Okay, so first nursing care plan is for decreased cardiac output. So what are all the intervention or planning we can do for decreased cardiac output? You know what is decreased cardiac output now. So in the planning session, you can write monitor vital signs, including heart rate, blood pressure, and oxygen saturation. Administer medication, and that is as prescribed, guys, as prescribed by the physician or cardiac specialist person. Okay, administer medication, for example, like inotropes or beta blockers, depend upon the condition and depend upon the frequency of the condition. Then assess for fluid retention like edema, weight gain, or etc., and educate the patient about the importance of medication adherence. These are all the major plan. Apart from that, you can write do physical examination and history collection and check vital signs. Okay, do metastatus examination. So these are all the planning you can do for decreased cardiac output. And what is the rational means? To ensure early detection, or ensures early detection and supports heart function. Next, nursing care plan for acute pain. These are all the major interventions or planning. Administer prescribed medication, provide oxygen therapy to enhance myocardial oxygenation, reassure the patient to reduce stress and anxiety, position the patient comfortably in semi-Fowler's position. Then if the patient is in semi-Fowler position, they can take breathe more than the other position. And what is the rational? Pain relief, reduce cardiac workload and improves comfort. That's very, very important. And also you can write do history collection and physical examination, check vital signs. All right. So this is the second nursing care plan. Third one, care plan for anxiety. The planning or intervention include use a calm, reassuring approach to communicate with the patient, provide clear, concise information about procedures and treatments, encourage the use of relaxation techniques such as deep breathing. So these are all the main planning you can go for anxiety, or you can do for anxiety, and at the same time you have to do history collection and physical examination. All right, then next to care plan for risk for activity intolerance. So the main plannings or interventions are gradually increase activity levels based on the tolerance, monitor for signs of fatigue, dyspnea, or chest pain during the activity, educate the patient about pacing activities and recognizing warning signs. So education is very, very important. Like they cannot do all the heavy activities all of a sudden, so you have to inform them, like you have to educate the patient about pacing the activities and recognizing the warning signs. Okay, so these are all the major planning you can write for risk for activity intolerance. And what's the rationale? Prevents over exertion while promoting gradual recovery only possible here. Then ineffective tissue perfusion. All right, so what are all the planning? Again, monitor vital signs, monitor for ischemia, check the ECGs, administer antiplatelets or anticoagulant medications as prescribed, educate the patient about the modification or modifiable risk factors such as smoking cessation and heart healthy diet. That is depend upon the condition of the patient. And the rationale, ensure optimal tissue oxygenation and prevent further ischemic events or ischemic attack. So these are all the nursing interventions you do for ineffective tissue perfusion. All right, guys. So this is about the nursing diagnosis and care plan for myocardial infarction or heart attack. So the major nursing care plans and major nursing diagnosis, I mean prioritized nursing diagnosis I have added here. So you have to start with cardiac output first. Okay, that's the first one. You don't write the last one, ineffective tissue perfusion or activity intolerance in the first position while writing the nursing diagnosis. While writing the nursing diagnosis, first you have to write decreased cardiac output. That is the first thing. Okay. Second one, you can write risk for ineffective tissue perfusion. Then you can write acute pain. Okay, or acute pain and ineffective tissue perfusion. Then anxiety, then risk for activity intolerance. So in that order you have to write. Okay, you have to prioritize the nursing diagnosis also to develop a nursing care plan accordingly. And you can write this planning. Okay, planning and rationale. And if you want to write in template, you can use this template. Okay, in previous videos I've added the templates for writing the nursing care plan. In this way also you can write, and in some places we will follow this format, nursing care plan template. So while writing, you can write the assessment. Okay, assessment, in assessment column always write subjective data and objective data. What is subjective data? What patient says. The patient says he or she feels pain, he or she feel shortness of breath, he or she feel restlessness, whatever. Objective data, what you have observed, like abnormal ECG, abnormal heart sound, restlessness, abnormal oxygen saturation, whatever you have observed, that you can write. In nursing diagnosis column, the selected nursing diagnosis you can write like decreased cardiac output or acute pain or anxiety related to, okay, so and so, as evidenced by so and so. Then goal, you can write short-term goal and long-term goal. Short-term goal like reduce the pain, restore the cardiac functioning. Okay, long-term goal like maintain a managed lifestyle. Okay, then in planning always write the present tense like administer. Okay, offer, provide. Okay, do history collection, do physical examination, do mental status examination, assess, monitor, like that you have to write. In rational, it's better to start with to understand the general condition of the patient, to overcome the situation, to assess, to maintain, to manage, to reduce, to relieve, like that you can write. Then in implementation, if you have done physical examination, you can have done physical examination, done mental status examination, check the lab report, given foul-up position or semi-foul-up position to the patient, educated the patient regarding the activities, like that you can write. In evaluation, you can write patient maintain normal cardiac functioning, patient reduced pain, patient regain normal functioning, patient maintain normal heart rate, like that. Whatever you have observed and whatever you have the patient regained, achieved, obtained, that you can write in evaluation. All right, guys. So this template you can use for writing that nursing care plans. Otherwise, in generally you can write. Okay. So this is the template. All right, guys. So this is about nursing care plans and diagnosis for myocardial infarction and heart attack. So myocardial infarction, heart attack, both the same, guys. So there is loss or lack of blood supply to the heart muscles can leads to ischemic attack or ischemic events. That means death of the blood cells, necrosis, and no oxygen supply to heart, and that can lead to heart attack or myocardial infarction or MI. Hope you understand, guys. Okay, next time with another nursing diagnosis and care plan. All right, guys. Thank you.